Hi students, today let's discuss regarding nasal spray. So the definition, nasal sprays which are used to deliver medications locally in the nasal cavities or systemically. So nasal spray means it's a form of medication that can be used to deliver such kind of minor particles into the nasal cavity, or it can be delivered through nasal cavity for getting the systemic effects also. They are used locally for conditions such as nasal congestion and allergic rhinitis. These are the primary indications for using nasal sprays to relieve discomfort from nasal congestion as well as allergic rhinitis. Okay, rhinitis means it's an inflammation of the nasal mucosa. Okay, so this is a picture of using nasal spray. It can also be used to get relief from sinusitis also. Then these are some of the pictures that showing some forms of nasal sprays. There are lots of or categories of nasal sprays are available. So each category will be having a specific purpose to deliver. Okay. So first is antihistamine. Antihistamines work by competing for receptor sites to block the function of histamine, thereby reducing the inflammatory effect. So during any infections in the nasal mucosa to relieve that inflammation, you have to provide antihistamine nasal spray because histamine which will be produced as a result of inflammatory mediators, isn't it? So to compete with these inflammatory mediators reactions, antihistamine nasal sprays should be delivered to the nasal cavity so that we can reduce inflammatory response in the nasal mucosa. Commonly used antihistamine nasal sprays are acetylene hydrochloride, levocabastine hydrochloride, and olopatadine hydrochloride. These are the common forms of antihistamine nasal sprays which are used to compete for the receptor sites to block the function of histamine. Next is corticosteroid. It is the kind of nasal sprays which can be used to relieve the symptoms of sinusitis, hay fever, and allergic rhinitis and non-allergic rhinitis. So in case of antihistamine, if the patient is getting any forms of allergic reactions, we can use antihistamine. But in case of corticosteroid nasal sprays, which can be used in case of to relieve the symptoms of sinusitis, inflammation of sinus cavities, hay fever, allergic as well as non-allergic rhinitis. They can reduce inflammations and histamine production in the nasal passages and have been shown to relieve nasal congestion, runny nose, itchy nose, and sneezing. So as we all know that associated with any nasal congestion or nasal irritation, patient may be having sneezing, isn't it? So to relieve such forms of discomfort, we can give corticosteroid types of nasal sprays. There are some forms of side effects that can also be expected from the usage of corticosteroid nasal spray, which include headache, nausea, and nasal bleed or epistaxis. The commonly used corticosteroid nasal sprays include beclomethasone dipropionate, budesonide, mometasone, and triamcinolone acetonide. So these are the commonly used corticosteroid nasal sprays. So the advantage of this nasal spray is we can get the relief from many signs and symptoms of infections such as sinusitis, allergic as well as non-allergic rhinitis and hay fever. Next is non-steroidal anti-inflammatory form of nasal spray. Ketorolac Tromethamine is the first and only non-steroid anti-inflammatory drug nasal spray, which is an effective non-narcotic alternative for patients who require pain relief at the opioid level. So we can get or we can use many forms of opioid analgesics to get the relief from various kinds of pain. But the only NSA nasal spray which is available to deliver the same effect, which means to get the relief from the pain, you can use ketorolac methamine. It is the first and only the NSA which can be available in the form of nasal spray to get the relief from the pain. Then saline nasal spray. I think most of us are more familiar with this kind of nasal spray, isn't it? So saline nasal spray, which can be administered to the infants as well as to the older people to get the relief from nasal congestion as well as to provide comfort to the patient from any form of allergic reactions. So saline nasal sprays are typically non-medicated. It does not contain any forms of medication, but it can deliver some kind of comfortable or relaxation to its patient. A mist of saline solution containing sodium chloride, which is delivered to help the moisturize dry or irritated nostrils. Associated with any forms of nasal infection, sometimes patient may be having irritated nostrils. While applying saline nasal spray, the patient will get the relief from irritation to the nasal mucosa as well as we can moisturize this dry or irritated mucosa. It is a form of nasal irrigation also. We can also relieve nasal congestion and remove airborne irritants such as pollen and dust, thereby providing sinus allergy relief. While exposing any forms of allergens like pollen or dust particles, after the exposure we can insert saline nasal spray. Through this we can get the relief or we can moisturize the dry nasal mucosa. Then this is a picture of a saline nasal spray. I think most of you are familiar with these forms of saline nasal drops, isn't it? Then there are three types of nasal sprays which are available nowadays. It is divided into hypertonic, isotonic, and hypertonic on the basis of the sodium concentration. First is hypertonic. The solutions have a higher salt content. From the name itself, we get an idea that what exactly it is, isn't it? Hypertonic means the solute concentrations will be more, which means 3% of sodium chloride will be present in this solution. It may be more useful at drawing moisture from the mucous membrane and relieving nasal congestion. So it is mainly used to relieve from nasal congestion. Then isotonic means it is commonly used form of commonly used sodium strength of sodium chloride, that is 0.9% sodium chloride. It will be having the same salt concentration as the human body, that is called as isotonic. Same concentration, same as that of human body. Isotonic saline nasal drops are commonly used in infants and children to wash out the thick mucus from the nose in case of allergic rhinitis. In the case of infants and children, following any forms of allergic rhinitis or inflammatory reactions to the nasal mucosa, there will be thick mucus secretions. As the immune response, there will be more production of mucus. This mucus can be plugged within the nasal cavity and the air entry can be denied. So to relieve that combine, we can administer isotonic concentration of sodium chloride nasal drops. Then hypertonic means 0.65% of sodium chloride. That is the concentration of sodium chloride in the solution. So these are the main three forms of saline nasal drops: hypertonic, isotonic, and hypertonic. Then next is topical decongestant. Decongestant nasal sprays are available over the counter in many countries, which means we can get these forms of nasal sprays without doctor's order because it can easily be available at many medical stores. They work to very quickly open up nasal passages by constricting blood vessels in the lining of the nose. It is mainly to decongest or to relieve the congestion of the nasal mucosa by constricting the blood vessels in the nasal mucosa, isn't it? So prolonged use of these types of sprays can damage the delicate mucous membranes in the nose. So as it is an over-counter medication, sometimes the patient can take this medication for a long period of time. So due to this prolonged usage of this form of nasal spray, which can cause damage to the mucous membranes. Decongestant nasal sprays are advised for short-term use only to relieve the complications of damage to the nasal mucosa. Most of the time, it will be preferred only for up to 7 days. Maximum of 7 days. The commonly used topical nasal decongestants are oxymetazoline and phenylephrine. These are the commonly used topical nasal decongestants. Then, how to use nasal spray. Till now, we were discussing regarding what is nasal spray and what are the common indications or what are the types, isn't it? The types we had discussed regarding antihistamine, corticosteroid, then saline nasal spray, isn't it? So next, we can discuss regarding how we can use these forms of or different forms of nasal spray. Okay, nasal sprays need to be primed before spraying into the nostrils because the direction of the nasal passages is towards our ear. It is necessary to bend your head forward and look at the floor before spraying it to the nose. This means the spray will pass directly into the nasal passages rather than hitting the sides of the nose. If this technique is not adhered to, it may be cause nosebleeds or epistaxis. So priming means before going to take or before going to instill the nasal drops into the nasal cavity, we should make sure that a drop or a spillage of these forms of minor particles can be come out from this nasal space, isn't it? So it is mainly to ensure that proper spill or proper delivering of these minor particles are ensured through this priming procedure. So I will show the picture in the coming slides. So while administering these forms of nasal sprays, you should ensure that it will not cause any injuries to the nasal mucosa because these are very delicate structures. The bottle is never completely emptied, so it is important to be aware of the sound when the spray is sprayed into the nose. So before going to perform nasal spray procedure, we should make sure that the bottle is having a required amount of medication. So if the bottle is near empty, we should not use it. Okay, if you don't hear that sound, it means you need a new spray bottle even if there is small amount of residue of medication left in the bottle. This is because the tubing will never completely reach all of the spray in the bottle. So it is never completely empty. So we should make sure that the bottle which is being used to deliver this nasal spray never completely emptied. Okay, this is the process of priming the nasal spray. So first, before going to perform the priming, remove the clam and shake the bottle. Then only the concentrations can be, or we can make a solution in an equal proportion. So press and release spray nozzles until a fine mist is produced. That is priming. This may take several times. Take care not to spray in face. So if you're performing this priming procedure, we should make sure that it is not focused there to our face. It should be done away from our face. Okay. Then this is the process of priming. So before going to perform the priming, we should make sure that we have shaked the bottle very well. Okay. So this is the process of priming. Then use the right hand to spray the left nostril and the left hand to spray the right nostril. Contralateral use of the hands are necessary to deliver this nasal spray. This again ensures that spray reaches the nasal passages instead of hitting the septum. If we do in such a way that we can prevent the injury to the nasal septum while delivering the nasal spray. Okay, so this is a picture of how we can perform this nasal spray administration. Next, we can discuss regarding the procedure on the basis of the containers into which we are taking this or the nasal sprays are present. Commonly, the nasal sprays are come in two different kinds of containers, the pressurized canisters and pump bottles. These are the commonly used containers of nasal spray. First is steps for using a pressurized canister. For that, gently blow the nose to clear it off mucus before using this medicine. So before going to perform this procedure, we have to make sure that our nasal cavity is free from any form of mucus, isn't it? So that we can blow the nose. Make sure that the canister fits snugly in its holder. Shake the canister several times just before using it. So before going to introduce this canister into the nostrils, we should make sure that the drugs are equally shake well within this nostril and keep head upright and breathe out slowly. Before using this canister, we should make sure that we place the head in an upright position as well as the patient has breathed out normally or slowly. Hold nasal spray canister arched on the drawing to the right. Use finger to cross the nostril on the side not receiving the medicine. So we should cross the nostrils into which we are not trying to instill that medication should be crossed by a finger, and we have to instill or insert the nostril, insert the nasal spray tip into the other nostril. Press down the canister as the person begins to breathe in slowly through the nose. Repeat these steps for the other nostrils. If the doctor has advised to instill nasal drops into both of these nostrils, we can perform or we can repeat this procedure. Try not to sneeze or blow nose just after using the spray, because after the administration of nasal spray, it should remain in the nasal cavity for at least for a short period of time. So we have to ensure the patient that, or we have to explain the patient that not try to sneeze or blow the nose immediately after the procedure. So this is the process of how we can use a pressurized canister. Pressurized canister means into which the medicine is filled within this canister, and we can close the nostril, one of the nostrils into which we are not trying to instill the medications, and the other nostril we can kindly insert this tip, and after inserting the tip completely, we can just press down this button so that these medications can be easily going to the nasal cavity. Okay, so this is the another picture. Then steps for using a pump bottle. Till now we were discussing regarding the procedure of how we can perform nasal spray if it is taken in a canister, or if we can use a pump bottle also. Gently blow nose to clear it of mucus before using the medicine, same as that of previous procedure or previous slide. Remove the cap, shake the bottle. The first time you use the pump spray each day, you may have to prime it, squirting a few times into the air until a fine mist comes out. So in the previous slide, we had discussed regarding what is priming. So before going to take this procedure, we have to make sure that priming has done. So before going to perform this priming, we have to shake the bottle very well to mix that medicine very well. Tilt your head forward slightly and breathe out slowly. Hold the pump bottle with your thumb and at the bottom, and your index and middle finger on the top. So this is the position how we can handle and how we can keep this pump. Okay, thumb at the bottom and index and middle fingers on the top. Use a finger on your other hand to cross your nostrils on the side, not receiving that medication, same as that of the procedure using a canister, and squeeze the pump as you begin to breathe in slowly through your nose. Repeat these steps for the other nostril. If you are using more than one spray in each nostril, for instance 2 to 5 again. Try not to sneeze or blow your nose just after using the spray. So this is a picture how we can hold. Okay, we can hold the bottom of this is the pump bottle, and the bottom we can hold it using your thumb and the index and the middle finger. It is mainly used to hold the top portions of the pump bottle. Okay, then this is the part of the pump bottle. This is the dust cap. We can remove this cap, and this is the applicator tip. This part will be inserted into nasal cavity. This is the finger rest. So in these 2 points, the fingers, that is index and middle fingers, can be placed. Then this is the pump, and this is the glass bottle with plastic sleeve. Okay, this area can be collectively called as applicator. Okay, in this portion, the medicines can be present, and by applying this pump, you can insert this medication. So this is some of the pictures that is showing what are the positions that should not be practiced while performing nasal spray instillation. This is wrong, because if you are trying to instill this medication, it cannot be fully absorbed into the nasal cavity. Okay, either position you can select according to your comfort level. Same as that other procedure, before going to take the medications, you have to shake the bottle very well and look down. Using right hand for left, contralateral hands can be used. Then the advantages of nasal spray or nasal medications, non-invasive route, which cannot cause any harmful or any pain to the patients. It is very comfortable and very easy method to deliver the medications and rapid drug absorption. The drug absorption rate will be very rapid and quick onset of action. We will get the result of this medicine administration is very fast and convenient route. We should not need any form of privacy or any form of precautions or any form of physical arrangements for delivering these forms of medications. It is very convenient and less time consuming and non-invasive route. Limitations means the absorption surface area is very less. When we compare with the gastrointestinal system, the nasal cavity will be having a less surface area, that the absorption surface area is comparatively less. And once the drug administered cannot be removed. Once you instill these medications in the nasal cavity, we cannot take out. Okay. The nasal irritation. Some of the nasal drops or nasal sprays can be irritable to the nasal mucosa. The damage to the cilia on the nasal mucosa. If you are performing this procedure in a wrong manner, it can cause injury to the nasal mucosa. Through that, we can damage this cilia also. Okay, so in this class, we have dealt regarding what is nasal spraying and what are the types of nasal spraying. There are different types of nasal spraying like antihistamine, corticosteroids, and saline nasal sprays, etc. And we have discussed regarding how we can perform this procedure and how it was discussed under two headings. That is, when we use pressurized canister as well as the pump bottle, and we had discussed regarding the parts and how the medicine can come out from this bottles and how we can use it. Okay, please go through this note, and if you have any doubt, you can ask me. Okay, thank you.